Good afternoon. I am Dr. Carlos Moreira. I'm an orthopedic surgeon here in Jackson Hospital in Marianna, Florida. And I'm chatting on the phone with Ms. Holly Kelly. She's our community educator at Jackson Hospital, and we're discussing COVID-19 and what you can do in regards to dietary changes and optimization for your health. Holly.
All right. Well, Dr. Maria, I think a lot of people would probably want to know, first of all, you're an orthosurgeon.
Correct.
And I've read a little bit about you that you focus a lot on your patient's diet. Why is that important as an orthosurgeon, and especially during this pandemic? Why is diet so important, do you feel?
For two reasons. One is that I find that the majority of patients that come to my office, they're really coming because either of their chronic condition made their joint pain worse, or their orthopedic condition worse, or their chronic medical condition caused their orthopedic complaints. So it really, except for like injuries from a bicycle accident or something like that where somebody will get a fracture, most of the patients that I see are really coming here because of chronic disease manifesting with orthopedic conditions. And then number two is that diet is extremely important when it comes to optimizing your health in COVID-19. So for people who have the influenza, oftentimes they may have mild symptoms or they can have severe symptoms. With the coronavirus, it's a little bit different. It really affects people who have comorbidities, who have chronic medical conditions. It highly increases the rate of admission or having to be intubated or of mortality. So there's a huge dichotomy with the coronavirus. Patients who don't have chronic medical conditions oftentimes get the coronavirus and they show no symptoms at all. And then patients who can have comorbidities such as obesity, high blood pressure, type 2 diabetes, insulin resistance, asthma. A lot of these patients, they can have severe symptoms of the disease. And so it's important to try to work on reversing those chronic medical conditions in order to optimize the patient in the case that they come down with the infection of the coronavirus.
Okay, so kind of like our diet and food, those things can lead to healing, possibly, helping us to prevent some things. So what advice then do you give your patients regarding their diet as far as specific things that you might tell them to include to eat?
Well, I normally give instructions to my patients who have an interest in losing weight, those patients who are diabetic, and those patients who have severe joint pain, because I think that dietary changes will help all those patients. And my recommendations really before and coronavirus are no different. I think the key is reversing chronic disease. And so some of the examples will be, number one is to cut off all sugars from their diet. Now, this is not just about not putting sugar in your coffee in the morning, but it's about avoiding foods that have added sugars. And I can tell you that almost all of the cereals that you can find in the supermarket have sugar added to them, in addition to the fact that the other ingredients are going to be carbohydrates, and carbohydrates eventually break down to sugars in the body. Other things that I would tell them will be to avoid other carbohydrates as well. That would include things like breads, rice, pastas, the cereals like I mentioned, oatmeal, even grits, all these products, that are mostly carbohydrates, in the body they break down to sugar, and they will raise your sugar levels and your insulin levels. Another advice that I give them is to avoid the so-called vegetable oils. These are, I know that the term vegetable oil sounds kind of natural and healthy, but they're really not. They're highly unstable. They oxidize easily. Most of these oils are basically industrial seed oils. So things like corn oil, soybean oils, safflower oil, canola oil, they are basically highly inflammatory. They're present in our diet everywhere we go because they're cheap. But people could be consuming them and not even know it. Even if you eat healthy food at home, if you go to a restaurant to eat, it's very likely that anything that you order that's going to come fried is going to be fried on a vegetable oil. And so I advise my patients to avoid those as well. And then in general, to try to avoid highly processed foods. It's better to eat a food that comes, or a food that comes from a farm and not from a factory. So those are my generic recommendations for patients. And in coronavirus is particularly important because we may not think that a diet can have an immediate effect on health, but as some study shows that it can actually have a quick effect, even as quick as 9 days. So they have looked at adolescents who the researchers were changing their carbohydrates and lowering the fructose, while the other group, they had the higher fructose. And fructose is found in regular table sugar. It's found obviously in high fructose corn syrup and cane sugar. And they found out that in patients who have fatty liver that is not from alcohol, in as little as 9 days, they were able to decrease the amount of the fat around the liver. They were able to decrease the amount of visceral fat, which is the fat that sits around the abdominal organs, which is inflammatory and is related to many conditions such as heart disease and so forth. And they were able to get better insulin parameters. So studies like that give me hope that people can start turning around their health in as little as 9 days, because the pandemic is going to be longer than 9 days. And for a lot of patients with chronic conditions, they may not be completely out of the woods yet until perhaps a good medication comes around or a vaccine, but they can certainly start working on their diet to prime their immune system in case they come down with infection.
Okay, so diet then is really important in helping not just right now, but later with their immune system. Is that what you're saying?
Oh, absolutely. And even things such as joint inflammation, it's related to high insulin levels. What I, in my opinion, the mothership of all these chronic medical conditions is insulin resistance, which leads to prediabetes and diabetes. And the problem with getting the sugar controlled with medications, or including insulin, is that it will get down the sugar to normal, which is good, and you do want that, but it still leaves behind the problem of a high level of insulin in your blood, hyperinsulinemia or insulin resistance, and that is implicated in joint inflammation and many other chronic conditions. And so really just using medications to control the blood pressure, or to control the blood sugar levels, it really only kind of solves half the problem. You still have the problem of insulin resistance, and the way to address that is through a low carbohydrate or ketogenic diet.
Well, I think all that is great information. And can you tell me, to be my last question, kind of what success have you had? Have you had patients come back and say, hey, I made these changes and here's what happened, something good?
Well, recently I saw a patient who told me that they had lost 80 pounds on a low carbohydrate diet. Now, that was not at my suggestion. I had just met them that day. So I cannot take credit for that. In years past, I've also come across with patients who were able to decrease the amount of insulin that they use, or perhaps even come off the insulin through a ketogenic diet. Now, it does take discipline though, and so some of these patients, they lost heart and they went back to regular diet, typical standard Western American diet, and then they had to increase their amount of insulin again of their medications. But I have come across multiple patients that have lost weight and have better control of diabetes with a low carbohydrate or a ketogenic diet. Absolutely.
All right, that's really great information. So the top 3 things, can you repeat those just one more time so that people can kind of get started today,
Right.
not tomorrow, but today, on those healthier eating habits? What are those top 3
Yeah,
things that you mentioned?
I would say the top 3 are cut off all sugar from your diet. And that includes reading the labels, read the ingredient labels. Don't just go by the front of the box. You have to look at the ingredients and see that there's no sugar added. Any variation of food sugar, whether they call it sucrose, whether they call it cane sugar, whether they call it agave, high fructose corn syrup, or regular corn syrup, but cut off all the sugar in the diet. I would say cut off other carbohydrates as well. Breads, rice, pasta, and so forth, white potatoes, and then also cut off the polyunsaturated fats, basically the seed oils, which would be basically corn oil, canola oil, safflower oil, cottonseed oil. All these oils are highly inflammatory, and I think by cutting off sugars and excessive carbohydrates and polyunsaturated fats, vegetable oils, I think people can make tremendous amount of progress in their diet and in their health.
All right, well, thank you so much for talking with me today, Dr. Maria, and I hope everyone will take some advice to heart and really start on a healthier journey.
All right, thank you very much, Holly. Thanks for joining me.
Thank you.